So we are now recording, and I want to remind you of who our wonderful panelists are today, Asa, Joseph, Melanie, and Leanne. In a moment, I'm going to have each of them introduce themselves. Asa is going to run through some slides to sort of level set and ground us in the discussion. And then we're going to open up for a very robust, brainstormy discussion where we can talk about strategies to rebuild, how we sustain trust, how we continue doing our program in the face of all this decimation. This will be a very much an interactive discussion. Want to hear and see and feel all of your light bulb moments, and hopefully we'll all have light bulb moments together. So let me stop sharing my slides. And before we go ahead and get started with the program, I'm going to go around and have each of the panelists introduce themselves quickly, and then we'll go to Asa's opening slide. So I just said Asa's name. So Asa, how would you like to introduce yourself today?
Yeah, hello everyone. My name is Asa Radix. I use pronouns he or they. I'm a clinician and researcher in New York City, and my main focus is clinical care and HIV prevention for trans and gender diverse folks. It's great to be here.
Thank you so much, Asa. And I should say Asa was a big inspiration for this webinar. I saw him present at a conference in June and got the wheels turning. So thank you so much for turning those wheels with me, Asa, and all of our other speakers. So I'm going to go to Leanne. Leanne, how about introducing yourself real quickly?
It's afternoon in South Africa, so I'll say good afternoon to everyone. So happy that you are able to join us. I'm Leanne van der Merwe. I am a researcher, a scholar, and I'm the founder and director of uh, um, Social Health and Empowerment, and we work on issues that are near and dear to trans women. Thank you very much.
And thank you for joining us from the afternoon in South Africa, Leanne. Let's go to Melanie. Melanie, would you like to introduce yourself?
Sure. Hi, everybody. Hi from Atlanta, Georgia. My name is Melanie Thompson. I use she, her pronouns. I'm a physician and have been doing HIV care as well as care for LGBTQ plus people in general since the 1980s. So, that kind of dates me. Have over 30 years of experience in clinical research developing new drugs for HIV treatment and prevention. I do guidelines work at the international, national level, including co-chairing the HIV primary care guidance. And I do strategic planning, especially at the local level for Ryan White Part A. And I would say that part of my identity is as an advocate. So I'm really happy to be here today.
And we are really happy to have you. Thank you so much for joining us, Melanie. And last but certainly not least, Joseph, go ahead.
Well, it's a hard act to follow all of these wonderful people. Hi, Joseph Cherby. I use they, he pronouns. I am reporting from very rainy and gray St. Louis. But I am an assistant professor in the Division of Infectious Diseases at WashU in St. Louis. I'm the medical director for the WashU Prep Clinic, and I'm part of the trans multidisciplinary team here at WashU. Also, I work across the Midwest through the St. Louis STI HIV Prevention Training Center, and I'm part of the board of directors for the HIV Medicine Association. Like Melanie, I consider advocacy a huge part of what I do. So I am really excited to get to chat with you all today.
Thank you so much, Joe. And again, thank you all for being here. Maybe when we get the conversation rolling, we'll ask the panelists for their favorite swear word substitutes. I don't remember any of them saying that in their introductions. So we'll spice things up in a little bit. But to get things rolling, I'm going to now turn over to Asa. Asa, you should be able to share your screen and go ahead and help us get some level setting here before we move into our conversation. And Asa, you are on mute.
Okay, how's that?
It is beautiful.
Okay, perfect. Great. So my role really on behalf of the team was just to reflect on some of the, the early days in January, and focusing a little bit on the executive orders and the impact on delivery of trans healthcare and research. And everyone's going to chime in, hopefully, along the way. We're not very scripted today, so okay. So yeah, so I mean, I think that many of us expected there would be a somewhat of an upheaval after the presidential inauguration in January, but this went beyond all, I would say, beyond all expectations. Within hours, there was a release of more than 25 executive orders. And I really wanted to focus on this one, which was the executive order defending women from gender ideology, extremism, and restoring biological truth to the federal government. Really was one of the most sweeping federal rollbacks of protections for trans and gender diverse people, I think, in US history. The order explicitly defined just two sexes, male and female, and declared these categories were incontrovertible, effectively erasing recognition of gender diversity. It mandated federal agencies to remove materials referencing gender, trans people, LGBTQ issues. And really, the implications go beyond semantics. It's already translated into widespread censorship of health information and research content. The consequences, really within a day were immediate and far-reaching across multiple agencies. So, CDC withdrew materials referencing gender, HHS reissued binary sex definitions, eliminating recognition of intersex and gender diverse people. The State Department suspended gender marker changes on, passports and, ex-passports. And really, I would say all of this really erased decades of progress in inclusive data collection and recognition of trans folk. The policy also impacted incarcerated populations. Trans people were transferred based on their sex assigned at birth, and they also halted care in prisons. Healthcare systems also saw attempts to defund systems that were offering gender affirming care to youth. I mean, there have been injunctions and we can talk about that, but I think just in those first few days, it seemed to be a lot of chaos and a lot of fear. And I think that was the point. Just some examples, Melanie worked on the guidelines for HHS, and, the section on trans people just, disappeared. It seemed like within hours, and I'm sure you all noticed pages on CDC, were missing. The executive order protecting children from chemical and surgical mutilation, followed quickly, also intensifying the rhetoric and policy restrictions. It framed gender affirming care as mutilation. It also labeled WPATH, the World Professional Association for Transgender Health, as junk science, and rescinded all reliance on WPATH standards, which had been, in documents before. Really discredited internationally recognized clinical guidelines. The other the hospitals had also become direct targets. There were federal subpoenas issued requiring facilities to disclose actually identifiable patient data for youth who had been prescribed puberty blockers or hormones. There were so many threats that as a result, more than 20 hospitals so far have suspended or closed their gender affirming programs for youth. I'll say also that individuals, providers have also felt, quite threatened. There are providers who are now facing punitive measures and under threats. Threats are being reported for providing care. There was a FBI set up a whistleblower line. And something that I think a lot of people didn't know, but for many clinicians who depend on loan forgiveness programs, these programs were actually rescinded for clinicians working in institutions that provided so-called child mutilation or, DEI programs, which of course, discourages clinicians from doing this care, which I think, again, was the intent. Not quite last, but I think we all recognize that the research impact was devastating. In those early days, over $800 million in research cuts, affected projects linked to gender, sexuality, or DEI. And studies on HIV prevention among trans populations, social determinants of health were systematically defunded. And, even though there have been injunctions, I just want to say that, especially for like my institution, when this happened, we actually had to let people go. Like we had to, we didn't have money to pay them. So, even when the grants came back later on, we then didn't have staff. So, and now we see that researchers are being forced to, reframe or anonymize their projects to avoid detection under the gender ideology clause. And the last EO that I really wanted to talk about was the one called Reevaluating and Realigning U.S. Foreign Aid. And this one, basically paused new and existing U.S. foreign development assistance programs with really only limited humanitarian exemptions. But I want to say, the important thing is that programs that were related to gender equality, DEI, or trans rights were not exempted, meaning that many international trans-led organizations lost critical funding streams. And again, this really represents a rollback not only of domestic protections, but also of US global commitments to human rights and inclusive development. And I just wanted to put a quote here from TGEU, which is Transgender Europe, that called this PEPFAR freeze, a dire threat to trans communities and the global HIV response. And I think we'll hear a lot more about that, especially from Leanne. So I'm going to go ahead and stop sharing so we can start on our Q&A. But I'm
Thank you
also
so
giving
much for that, Asa. And I think just want to open up to see if Leanne, Melanie, or Joe want to add any kind of background to what Asa has already laid out. Like we said, this is very unscripted, but wanted to just offer you a chance to add in any color commentary.
Melanie or Joe can go first.
How
nice of you, Leanne.
Well, I'll jump in with a couple of comments. And first of all, regarding the federal guidelines, kudos to ASA and others for really leading the development of a robust section for trans and gender diverse individuals in the HHS guidelines. And they did disappear from the guidelines, but they are not gone. You can find them on the Wayback Machine. In fact, many of the pages that have been taken down have been preserved. There was a huge scramble among people in all sorts of agencies and health professions to preserve these. So they have been preserved. They're a little more difficult to get to. But I also just want to point out that, as we have seen with our vaccine guidelines, which have been just a disaster, professional societies, I think, are working to fill in the gaps so that we actually have science-based, evidence-based guidelines to go by. An example is that ASA led the section in the HIV primary care guidance about trans and gender diverse individuals. And, at that time when we wrote it, we thought, okay, we're referring to other places and, we may have to go back and revise that section and make it more robust so that people can get more advice. But, I do think that these have been devastating actions, and we have to look at each one and see what we can mitigate.
I will
Thanks for
also
that,
just,
Melanie. Go ahead,
yeah.
Joe.
I will also just add, like, so in addition to the HIV guidance, with respect, I work in the STI sphere as well. Trans guidance on the STI guidelines has been completely removed. The national HIV curriculum, STI curriculum, have all had their transgender sections removed through guidance from, HRSA as well as other things. I need you all to understand a little bit of the context here, which is what has made this so difficult for many of us, right? Which is that, for years we have been asked on NIH grants, CDC grants, any federal grant to include sections on how we will be inclusive of certain communities that have been marginalized and, historically neglected. That has now been used to target these exact grants and to remove them, oftentimes with certain, like they might not even be related to gender diverse communities in any way, but, certain grants have been completely removed or restricted from the federal government purely because of inclusion of these populations. And then I will also say that the government, Trump 2.0 is very organized. We all know this. They had Project 2025. They came at this with a very clear vision. And what terrifies me is, I noticed that there's some, comments about, certain places like Fenway and certain places like Whitman Walker and other places that have restricted access to youth gender affirming care. But you have to understand that these are federally qualified health centers. All of their funding is being threatened for all of the services they provide based off of their provision of youth gender affirming care. And from the discussions with these organizations, they did not make this decision lightly. This is really, really hard stuff because at the academic level, at the community-based organization level, at any charity level that has a federal designation and tax status, they can use this to leverage against us and our status in order to try to shut some of these organizations down completely and remove access to all healthcare that these places provide. So it is a constant moving goalpost that keeps us in anxiety. We're worried about Ryan White access. We provide gender affirming care in our Ryan White Care Clinic. So if they say no Ryan White Care Clinic can provide any transgender health care, what do we do? Right? What would the decision be? Do you restrict access to a little bit and try your best to take care of that community while also taking care of the majority of your other patients that don't happen to be gender diverse? It is a really, really hard decision, and the goalposts are constantly moving. So I wanted to set that context a little bit because it's very easy to say, this is unfair. We all agree. All of us on this panel are in agreement that this is that we wake up in constant fear of what the new day will bring. But we have to make some decisions. And honestly, we're playing defense here. We are not even at the point where we are able to play offense. So keep reading up on this stuff and keep reading up on all of the different contexts that go into all of these things.
Yeah, and Joe, thanks for saying that. I do think a lot of the anger is completely misdirected. We need to focus on the fact that this is the federal government who has caused this to happen. And I think that many organizations are, yes, one, making difficult decisions, but it's very hard to, second guess when you're not there in the situation. But I think that there's a lot that's happening behind the scenes that people can't even talk openly about because they will become targets of the federal government. So I would say, give these organizations a bit of time because they really are trying to do the right thing.
Thanks, Asa. And Leanne, do you want to jump in with some background and context to share here?
Yes, thank you so much. For me, the frustration lies at the point where, for us at the moment in South Africa as a trans community, it's not just about USAID PEPFAR. The Global Fund has also been impacted by these funding cuts. South Africa as a country is, key population funding is almost exclusively externally funded. And so there lives, there is a very big vacuum. But, what makes my blood boil in this particular moment is the fact that we've lost USAID funding, which funded 4 trans-specific clinics in the country. But we continue to be patronized because the Global Fund implementation is starting any day now. And of course, we've regressed back 10 years. None of the Global Fund key populations recipients includes trans-led programs. It is implemented by 3 organizations that are essentially organizations serving. One is a big public health institution. The other 2 are organizations that are developing and implementing programs for men who have sex with men. So none of the trans-led organizations have made the cut. And that's what's so particularly painful for the trans community at this moment, is that we've regressed back 10 years. 10 years ago, in fact, 15 years, in 2010, we issued a statement in which we made it clear that trans people will not be the stepchildren of the HIV movement, that we want to be upfront and center. I don't know how the Global Fund can allow that in 2025 against the backdrop of trans programs being shut down overnight. The Global Fund continues to drive that isolation, continues to drive that exclusion in which they expect of trans bodies to go and sit in programs that are designed and implemented for men having sex with men, not in 2025. I'll say that over.
Thank you, Leanne, and thank you again to the speakers for sharing more background. We weren't intending on this to just sort of be a webinar that catalogs everything. We want to obviously acknowledge how terrible everything is and what has happened, but really start putting our heads together to think about what we can do. And I appreciate everyone. We appreciate everyone who shared comments and questions when you registered. And Brian Manalga just put something great in the chat and really pulling out what Asa and everyone has been saying around our anger. And we have a lot of anger and justified anger. And, I think there's a tension. How do we hold, I don't think, and also Brian pointed it out, like, how do we hold each other accountable and support each other at the same time and direct our anger appropriately? I think I would love to explore this and how we actually navigate this. You've all laid out like how tricky this is and how many of us don't know the conversations happening in the back rooms. But what seems to be an issue that I've been noticing for the last several years, and it's been never more apparent, is we have very few people advocate-wise who are in the outside game. So many of us are in the inside game, inside and various tables inside, but there's not enough of us, I think, throwing rocks from the outside to drive change. And that's how we made things change back in the day. There were crazy people on the outside and more sober people on the inside, and we all worked together to somehow move forward before the government cared about any of this stuff. So how do we do this? Who wants to jump in and start thinking about with us how we hold each other accountable and are critical with each other, even as we're on the same team and moving forward, hopefully in the same way, and directing our anger appropriately. What does someone want to jump in on that?
I'll do it.
Joe
I
does.
like this. Yeah.
Yay!
As the Arab on this panel, let me tell you about harnessing anger in the
Thank
form
you.
of protest. And so what I will say is this, is that, all of us are angry right now. Let's set that as a tone, right? We're all angry. Many of us happen to be part of the communities that are being targeted, and there is a lot of grief. There is a lot of mourning. There is a lot of fear, right? And this is all valid. And I want to emphasize this, that, like, I want, I want to say that everyone should go to the streets and protest, but some people don't necessarily feel comfortable or safe doing that, right? They have family on the line. People have been doxxed. There have been direct targets of things. We have to understand that there is danger in addition to all of this. So I want to say that each and every one of us should take a level set of like what we feel we are comfortable with in terms of our level of participating publicly in protests, or if you want to take things behind the scenes as well and try to work on I always say advocacy, it can be one-on-one level advocacy. It can also be at a systems level. It could be at a regional level, state level, national level, international level. All of that advocacy is valid. But I also want to emphasize here that we, as healthcare providers who work in these communities, oftentimes we find ourselves in a situation in which we are the only person from that community that is being targeted in the large room, right? And we need to do a better part of engaging community, making sure that we move beyond community advisory boards and all of this stuff and actually put people in community in positions of power so that they may have a say at the table behind these closed doors. Now, I will also put a call out to healthcare providers, which is that we cannot pretend that we just need to survive the next 4 years and that things are going to return back to normal. We need to stop that. It's not going to return back to normal. That it's easy to destroy, it is hard to rebuild. And so, us as healthcare providers, we need to do our part in trying to reformulate this, but also go out and protest and find a way to protest. That is the hardest part, I think, for us, is we're trying to figure out what best way can we protest as healthcare providers that also doesn't massively affect the already neglected populations that we aim to serve, right? Like, I can say we can all walk out, but that means that the hospital may not have someone to take care of patients. So I would love that, but we need to find more creative ways to hit our hospital systems, to hit our academic institutions, and make sure that they know that we disagree with what's going on. I'm from WashU. We are actively participating in negotiations to join the Trump Compact. We are literally protesting on the faculty senate side. We are flooding letters to our chancellor and all this stuff to try to prevent this from happening. But again, we have to figure out what happens if that does happen. How do we protest? Do we hit them financially? Do we hit them in recruitment? Do we hit them in many other ways? There are so many ways that we can protest. But again, I want everyone to kind of feel what their litmus test is as their comfort level, do so safely, but also find ways to be creative and kind of come up with new ways to protest from within and outside.
Thank you for those very thoughtful comments, Joe. Melanie, I see you're off mute. Are you want to jump in there?
Yeah, I think I never put my mute back on, bad on me. But
Not
yeah,
at all.
I do want to comment because of course I agree with everything Joe said. And I just know in my own community, communications are very fragmented. And I think we all have to take a look at what we can do on the local levels to talk, to be better in terms of communicating with people on the ground who really don't know what to make of some of these things. You know, as Asa said, there are a lot of people in institutions and agencies that are working actively on preserving programs, preserving services even though the program names may be different. And I think we need to work on sort of more informal structures for communications and social media, but also in person and in agencies, so that the word gets out to people that even though something may not be called DEI, you're not being abandoned, that the people who are providing care do care and are working hard to be sure that we can do everything we can to preserve services. And, you know, I know in our area of the world, as well as nationally, a lot of language had to be scrubbed from Ryan White resubmissions. So to get your grants approved, there were resubmissions that had to happen and words had to be taken out if you wanted to get approved. And some people who were project officers were very helpful in saying, well, maybe you could say this instead of that. And the idea of really preserving services while maybe giving away some of the language, I think, is fundamental to what we need to do for programs. And then, you know, I want to also go back to the advocacy issue. And it's clear that many people don't feel comfortable with advocacy having to do with some of the specific EOs, some of the specific court cases. But there are a lot of other areas where we can advocate, because things like the urgency on expiring subsidies for the Obamacare insurance, expiring SNAP benefits, which will happen on Saturday, these disproportionately affect our populations. So, you know, we have a vested interest in advocacy on those things. They are more neutral kind of things to advocate for. So, you know, to encourage people to reach out to their representatives and their senators, particularly Republicans, and to fight back on some of these issues, which are urgent and maybe in some ways a little easier for some people to advocate for.
Thank you, Melanie. Asa or Leanne, do you want to weigh in on this part of the discussion?
I will. And I totally agree with everything that Joe and Melanie have said so far. I mean, I think we need to acknowledge that when you change the language and do those things, that it is perceived by community as complete erasure of, you know, your identity, your whole existence, right? It's incredibly painful, and we have to, you know, balance these very difficult decisions, as you said, with better communication, ensuring that you have, you know, folks on your team who can serve as a, you know, a go-between, you know, with community to explain the reasons why. If the first time you see something is you go to the website of where you've been getting your medical care, and all of a sudden all references to trans people have been deleted, or you're in a research project, you're a participant, and, you know, I don't know, perhaps your identity is now reassigned. This actually happened to some people where, you know, trans women were all of a sudden being discussed as men. We need better communication. Like, why is this happening? And I think the other part about advocacy is, and I agree with Joe on this, is that we can't all do everything, you know? We can form coalitions, again, coalitions with community partners, coalitions with other agencies that are trying to do the same thing. I think for far too long, many of our organizations have really operated in silos. I mean, I will say that I've spoken more to other CBOs in this year than I have in my lifetime, you know, just like leadership from so many, you know, trans-led organizations, because we're all finally sitting together and talking about, you know, we you know, it's a common enemy that's drawn us together, but it's actually been so helpful and actually goes beyond the issues of preserving care.
Thanks, Asa. And Leanne, I can see you wanting to jump in.
Yeah. I remember something very powerful that J.D. Davis said once when we were working on the Trans Manifesto. And that was to say that trans people are, should take, center stage in the HIV movement, and that we are part of the solution. And that has never ring more true for me now than it has ever been. Being in a country that is away from the US, I don't have that proximity of my work being scrutinized or my activism being challenged. I don't have that proximity to the US, but I live in a country where we've always given fair and equal treatment to each and every citizen. But for me, it started to feel like now that the US has left, the funding is gone, we're kind of like eroding back to a space where communities are no longer part of the problem. I find it very, very hard with what's happening with how the Global Fund grant is implemented in South Africa at the moment, where trust is being eroded. Key populations are put in a place where they are not seen, they are not heard. It would be interesting to know how many key pops-led organizations are actually going to be implemented. And I know that we have to think very innovatively in this time of austerity, but you cannot do that at the expense of, sidelining key populations who are part of the movement. Thank you. Over.
Thank you, Leanne. So true. And JD is with us. JD Davis, you just mentioned, is with us, and I know they have to run off to a class shortly. So, JD, did you want to jump in and throw some of your spice into the mix?
Hi, thanks. I'm here in my bathrobe in bed. I'll be.
Hey,
Uh,
JD.
yeah, people asked to talk a little more about what I said about the No Kings movement, and for people outside the U.S. who may or may not have heard about that was just that's the overarching term mobilization that happened a few weeks back that led to protests in something like 2,400 locations in the US. And that's an example of, when they had sort of the lists of what the problems were in terms of their central messaging, they didn't include trans people. And I don't think it's intentional that they are, anti-trans, but I think it's not understood by some people, even progressives or on the left or people on the outside, how much and how trans people are not just being targeted, but are being used to try to further autocracy in the US. We're like a rallying cry for the opposite, the other side, to get people riled up. And people who may be very supportive of things like immigrant rights and federal services may have heard a lot of misinformation about trans people, particularly trans adolescents. When you have outlets like the New York Times have been spreading misinformation and bias against trans people for years. So this is an important moment. I can't, I mostly know just about the US, but there's a mandate, an opportunity and a mandate to speak the truth about trans people to our neighbors, to our relatives, to our coworkers, um, because people have been fed lies. And I'm a trans parent of a trans adolescent, it's a particularly scary time for so many of us. But so it's important to ask if you see like mobile calls for mobilization to ask where are the trans people, or why are you not centering trans people? Point out the messages put out about the food cuts in the US, which is SNAP benefits. The federal government is saying it's because the Democrats want to do genital mutilation of children, right? So we are being used and targeted to try to get everyone to blame us. So it's really important to, whether you feel like you're an insider or an outsider, if you see messages on a neighborhood bulletin board or whatever, ask about trans people. It's not just about having us, as an included population. It's about recognizing that there's specific attacks on us that are both particularly dangerous for us and for everybody. right? Because they're using us to further fascism.
Thank you, JD. You're getting a good amount, a deserved amount of love for those comments. I think I would co-sign that. I think we all need to be absolutely centering trans people, and that is something that we can all do in small, medium, and large ways. And I was just also thinking, and maybe this is a little more U.S. centric in terms of the erasure of programs and how we can try to continue. I guess I want to get into how do we continue to sustain programs when we've erased people? People do feel erased because they have been, and programs have been let go, studies have stopped, services have ended, but we need to continue to sustain, right? So, what do we need to do? What is our underground kind of railroad moment? What is our moment like the Chicago Black Panthers who were, feeding and educating people back in the day and are starting that up again? How do we do sort of massive code switching on a huge scale where some of our messages that could be seen by the feds say one thing and our message, and yet we have to Melanie and Joe's point, very clear communication to community that we're still here for you, we're still serving you, here's where you can come. So I think there's a number of issues here, how we actually keep programs going and how we communicate that in a situation where everything is in grave danger. So who wants to jump in on that easy topic?
So I will share from the South African experience on how we've managed to sustain even minimal services. So I live in a city where they implemented one of the 4 clinics that was funded by USAID PEPFAR. And I will say this is that my discontent really lied with the fact that that organization, big public health institute, not community-based, not community-driven, that organization left here with so much, without even so much as a goodbye hug, right? They literally vanished overnight. When that organization came here initially to implement their programs, what they've done fundamentally wrong was not to strengthen the relationship, the relationship with community-based organizations to ensure that mobilization continues when they will leave after 6 or 7 years or however long the grant was. But when the executive orders came, they left overnight. And what that really means is that those folks have to be integrated somewhere into some form of care. And what that takes is community organizations picking up folks, linking folks to care, and while you're at it, also kind of doing the sensitization of this is the person who was with Clinic X, and as you know, Clinic X has left. We now have this problem. So that's quite literally what that means. We were fortunate enough to get 2 cents from one of our donors to kind of like do that linkage work, because that is what is going to sustain folks, going forward. But again, it brings me back, at the risk of really sounding like a stuck record, it brings me back to this idea that in everything that we do, most times you will find that there is a CBO working on something. And when these big public health institutions come and implement in our names and without giving us any meaningful participation, where we only go to check that box, provide our blood for HIV testing, and be given or not given an incentive for participating, because, what does that incentive mean nowadays, When those organizations come and they implement, this has been the example of what can go wrong where you are letting down an entire population. And context is so important. It's really important to point out the context of historical marginalization of trans people, where we were told to go and access services that was designed for everyone except us, right? So this big organization comes and implements and the funding gets cut, shoop, overnight they are gone. What do we do? You know, this is the part of literally running around and making sure that folks have access to what they need. But even that is not a very easy thing to do for a community that is hidden, that is so deeply marginalized and continue to be marginalized with what all of this calamity against trans people in the world. I'll stop there.
Thank you for making those points, Leanne. So important. Joseph, I see you off
Yeah,
mute.
I'm really moved by what Leanne said, and it dovetails perfectly with what Asa was saying as well earlier about how we're all siloed, and how we now are removing some of the silos, and I love to see that, right? I love the we have all been told that we're all competition for grants for years, right? And when this organization gets a grant, we try to help, but like they want to make sure that they don't let their information out to the other group to get the grant and all that stuff. But I want to emphasize here, I was recently at one of our community-based organizations fundraising event. They provide housing for people living with HIV and who has substance use disorders. And what I will say is that the rallying cry was a reminder, and I don't need to remind many people in this room, and I'm very cognizant of my age here when I say this, but this movement did not start with academic organizations and the federal government and grants and all of that stuff. This movement started in basements, in community-based organizations focused on community, and that is what it was built off of. And that rallying cry is something that I think we need to understand here. And when we're rebuilding something new, because it's all being destroyed, maybe we could do it better. And maybe we can actually center community for once. And maybe we can take these community-based organizations and actually, as Leanne was saying, start from the get-go, start with the community, put those community people in positions of power, find ways to make sure that they are in leadership. So we don't need focus groups, so we don't need any of that stuff. How do we do that? And so there's a group of organizations who met up together and tried to say, listen, at the beginning of this crisis, we are not competition. We all need to unify. And I think that we all need to kind of take a step back and understand that we're all going through this together at the same time. Like, we're all going through this together. I think you all need to hear that. We're all going through this together. There is no new crisis that any of us are facing. We are all facing the exact same things. So why aren't we talking more? Why aren't we collaborating more? Why, as an academic institution, why am I not on the phone with Melanie every day or Asa every day or all of these? Why are we not doing that? And I think we need to just break those barriers down. And so that's all I have to say on that. It's just what they said dovetailed beautifully. And I just wanted to create a little bit of a call to action on that.
Love that. And we definitely like more discussion in this space about how we move forward, how we can all agree like the systems before sucked. That's the official word for it. They sucked, and they dehumanized the people who got services through the system. They dehumanized people who worked in the system. They do not serve us. They're not led by community, so they can leave at any time um, without saying goodbye, as Leanne said, without so much as a kiss goodbye. And so we have a huge opportunity to rebuild something that's not white supremacist, that's not colonialist, that's not capitalist only, that centers who we are and who we are as community and puts us in leadership, centers trans people. So I'd love to hear more about how we move in that direction and how we make sure we have more of these discussions, that we are not only, we're getting on the phones with folks, we're using all of our opportunities coming together to have these discussions. It seems that we're not taking advantage of everything we could be, and would love to hear more about that.
So, I'd like to chime in about the responsibilities that healthcare providers have, because, we try our best. We've done a crummy job over time of really focusing on communities that are vulnerable. And I know when we were doing the HIV primary care guidance, we really expanded our section about providing care that was culturally sensitive, that was representative, where people felt comfortable when they came in the door and were greeted at the front desk. I think this kind of training, this kind of education for care providers is very important. But I also think we need to get out of our silos. Getting care at a gender affirming clinic is not the only way to get gender affirming care. And I think all care should be gender affirming, whether people are getting medications or certain treatments. But we do a terrible job at training our primary care providers. So, even in the field of HIV, we don't have enough HIV experts to take care of all people with HIV. But we haven't done a good job of training our primary care providers. And I think in terms of services for trans and gender diverse communities, we really need to step up our game and reach out to the people who are not in our bubble, and reach out to people who are in primary care and providing services to people, and help them get training about how to provide a clinic environment that feels safe and feels welcoming. And, what are the things that matter to trans and gender diverse individuals? And, I think here is a role, an important role for our communities to be part of that training. That, it's a very powerful thing for a healthcare provider to hear directly from people who are impacted about what the impact is. So I think professional societies need to be sure that we are including trans and gender diverse people in our trainings. And we need to do more for service integration. So, preserving gender affirming care in clinics where we can, but recognizing that many people don't get their care in these clinics anyway. And we need to do a better job of stepping up as care providers, being vocal, training our peers, and reaching out beyond our bubbles.
Go ahead, Asa.
Yeah, and I can add on to that. Thank you, Melanie. I mean, definitely training is just so important. I learned earlier this week that in Texas, they're going to eliminate all mention of trans people, out of the curricula for medical and nursing schools. I mean, I can't really wrap my head around it, because it really is so awful. As though if you don't teach it, these, trans people don't exist. Of course they exist. You're just not going to be prepared to provide care to them appropriately. So I like the idea of medical organizations and societies picking up the slack, because the need is going to be so much greater once more states start eliminating these topics from the curriculum. I also wanted to go back a bit to, where are people going to find care if, all the mention of, for example, trans people, LGBTQ folk are off websites. And just to say, I've spent in most of my life, actually not in New York, but working in the Caribbean. And so I've lived through this before. I've lived in countries where being part of the community was criminalized, right? So where do you go for care if you're a criminal, right, in that society? And community-based organizations really picked up the slack there. You always knew if you were in a country where you could go to find affirming care. There were always providers. They couldn't be open about it, but the community-based organizations could steer you in the right direction. So we need to remember that the community took care of itself, has always taken care of itself, and has ensured that people do have access to care. If things get worse, it may not be as open. I mean, I will say I've seen so many places that have pulled, areas of their websites, pulled down web pages, taken out information, hidden gender affirming care under primary care, so it's not the first thing that you see when you go to the website. But again, we need to know who to blame for this. These are organizations that are struggling to survive here and struggling to ensure that they can continue to provide the services. So I'm seeing if Leanne is off mute now. Go ahead, Leanne.
Thank you so much, Asa. Yeah, all very, really, really important things to do. It's about finding the innovation to serve ways in people that we haven't served before. I always say, and I said to my team when this news came, that there's also opportunity in every crisis. If the crisis is big enough, it will drive us to innovate. It will drive us to find new ways of doing. And maybe, part in what we've done, the picking up of clients and linking them to care and, having the 10 minutes in doing the sensitization and explaining somebody why the correct pronouns are important if we want to get folks to come back to our services. That's all part of, as Joseph said, that's all part for me as the rebuilding, right? And I don't think the rebuilding is going to start after Trump is leaving office. The rebuilding has to start now. We cannot wait for a time when ex-president come or ex-president. There's always going to be a crisis in the world. There's always going to be this or that going on. And we've got to recognize the opportunity that exists because this is pushing us to really do better. But I also want to give recognition to say that it is very hard to think of innovations with this level of calamity in the world. It is a time in which we can't really relax. Melanie has pointed out so very eloquently that, clinicians are working overtime. We've got to find innovative ways. Do we bring folks into our, practice after hours? How do we do, we've got to figure out as we are going along. But we also have to remember to be gentle with ourselves and gentle to those that we serve, as we're trying to figure out this particular moment that, in which the world is in so much chaos and calamity. But I can also speak of like a few things that happened as a result of the crisis. Like, for example, our health department came and said, okay, we are making hormones available under a conditional grant. Folks can get it. The next part of that fight is to get it out of a tertiary level of care and putting it in a primary level of care because one, it is so costly, and two, it puts it out of reach for folks who cannot travel to often urban-based tertiary levels of care. But we now have practitioners who are available to say, I'm willing to prescribe. In the absence of having nothing, I'm willing to prescribe, I'm willing to make a linkage, I'm willing to make a referral. I went to a training, I think 2 weeks ago in a city called Taibeja, where, doctors, presented this kind of moment in which we find ourselves. And I had so much respect for those doctors who then got up and said, in the context of everything that's going on, I'm still willing to do this. I'm still willing to help. If it means pushing extra hours, how about we bring folks to a point of care? We get a car 5 people can go in there, we get folks to a point of care. These are the small innovations that will have very good results, but we cannot wait until the orange person has left that office until we start rebuilding. Some of that has to start now so that we can gain momentum. Thank you very much.
100%. I'm 100% with all of y'all. You're all brilliant and helped so insightful in helping us grapple with this conversation. I'd like to go back to how we, and Leanne has brought this up, we've all brought this up, but how we hold ourselves accountable and be gentle even when we have to deliver some tough love to each other. I think because I think a lot of our problems have been deeply embedded in our work for years, and this current environment, lots of things have been exposed, but it's not all due to the orange creature, right? It's also due to us and years of calcification in some cases, and capitulation, years worth. And so I guess I struggle, and I'm trying. I have a hard time with this just as a person, but how do we stay gentle with each other and tough at the same time? Because I feel like, I don't know. I mean, maybe it's just my own rage is just all over the place, but I'm mad at a lot of sort of us in our space that um, uh, sort of have contributed to where we are, or aren't doing what they could. And I guess I'm struggling with this, and I imagine other people may be too. So how do we do better at sort of being both tough love and gentle, and how do we call people in without kicking them out? What do people have thoughts on regarding that? Jump right in.
This is Tonya. I can jump in.
Yeah, thank you, Tonya.
Sorry. I just think, I guess what I see a lot is people putting people on blast on social media. And I think we are human beings and communicating with one another, especially if these are people, leaders, community organizations with whom you have relationships and know, and can not attempt to shame publicly unless that's a last resort to try as a strategy. But as a way of calling people in, building on those personal relationships, I think is really helpful.
Mhm.
You're so right. And I've been talking with other advocates about this, and sort of this thinking around. We've had some real issues that have preceded where we are now, and part of it is, I think this tension between in real life and online. And so much of our advocacy and our engagement and our communication with each other has gone online. And that got even more intensified with COVID. And so much of our interaction is through Zoom. We're not meeting in person. And so we're engaging in line, we're saying things online that we would never say to someone directly in person. So maybe part of this is like we need to, not only do we need to prioritize community, we need to prioritize IRL, in real life, to the extent we can. Like Zoom is a great conduit. These are great tools to have, but when we try to do everything with these tools and we're not together in community next to each other, human beings next to each other,
Hmm.
to work harder on the IRL part of it all.
Yeah, I just want to add that the social media, I mean, the amount of accounts that I've had to unfollow because of like, you'll never believe what the Trump administration is doing today, and just adds like anger constantly at you. And it's just like, there's no conversation there. There's just constant rage bait, and I myself have to turn off my rage bait aspect of certain things as well. But what I want to what I think is helpful in the situation is recognizing, like Tonya said, is recognizing the humanity, but also understanding that sometimes we may disagree on something, and that's perfectly fine. But removing an ideological disagreement from the personal disagreement, if that makes sense, right? Like, I'm not attacking anybody personally here. I may disagree with what Asa says. I say that because I never disagree with what Asa says. But like, I may disagree with what, Asa says, but we can still respect each other and respect each other's viewpoints, where we all come from, and all that stuff. And I also want to, in our training center, we speak a lot about cultural humility and trauma-informed care and all of that stuff. And I want to emphasize that each and every one of us on this call carries our trauma with us, right? Like, I am an LGBTQIA plus person from the Arab world who grew up in the Arab world, and I carry that with me everywhere I go. And so sometimes when that's poked, my first reaction is to poke back, right? Or to get angry again. But I, through these trainings and all this stuff, have realized, like, this is just my trauma coming up, right? This is my experience coming up. And that person on the other side of the social media, the phone, the whatever we're talking, doesn't know that story and doesn't know where that's coming from, right? And so I think we can all learn a little bit, especially from community, on, like, why is community, I always get asked, why is community so angry all the time? And why do they attack all the time and all this? And I always have to remind people, I was like, this is trauma. Y'all have to understand that we are constantly being beaten over the head with re-traumatization. And every time we have to speak to this stuff, we have to bring back our trauma. And every time we share our story, we have to bring back our trauma. That's taxing. That's exhausting. And the fact that we have to, as LGBT plus individuals, as trans people of color who have had to experience nonstop trauma throughout their lives and had to fight their way to get advocacy, you can only imagine that their anger is valid, right? But I also want to take a step back, because what I learned how to be angry from being in the Arab world, but I want to take a step back and remind people that yelling is not the way to communicate across to someone who disagrees with you. You have to share that personal story, that humanity. I go on Advocacy Day every year in rural Missouri, providers, all deep dark red. The only thing that rings true to them is reminding them that their constituents are suffering, and that bringing those stories to the table, they will listen. And they do. They always do. The moment I bring up personal stories, if I quote statistics at them, they don't give a crap. They don't care. They hear wokeness being thrown at them. But if I talk to them and say, hey, I actually reached out to some of your community-based organizations, this is what they're worried about, they listen. And so, again, trying to take that step back, understanding who you're speaking to, understanding they may not agree with you, but you can recognize that you might agree on something, maybe just a bit of shared humanity, and maybe using that as a thread to go in. Use your anger as fuel, don't worry about it, but also don't just yell, because there's a time to yell. I love yelling, but also understanding that that will never convince the person across from you. That'll make them dig their heels in deeper sometimes.
Thank
But
you,
also
Joe. And I
for me,
really appreciate you also just bringing up your ethnic and racial identity. We haven't talked directly a lot about this, but you certainly what's happening with immigrants, migrants in our country is just unconscionable and equally as vile as what we are doing to trans people. And certainly so many of the folks we serve are immigrants, are here on various levels of documentation or not, people who have been here for decades, regardless if they've been here a minute or a decade. And I just wanted to make sure we mentioned that. And if anyone wanted to sort of talk about the intersection of immigration in this moment, I would be, it would be welcome.
not really immigration, but for me, it's all connected, right? It is a moment in which, as trans women, we are not just attacked on the basis of gender ideology, but there's also our race. There's also so many Latin American trans women in the US. That kind of geopolitic that sits there has to be unpacked and looked at in a way that is intersectional. And I'll tell you something about intersectional is that a, a lot of the systems of oppression is also very ironically starting to operate in intersectional ways. by the way that it attacks you on one, you know, one oppression or the other. If we don't get you for being Black, we'll certainly get you for being trans. And this is very much an ideological fight, and we have to keep that in mind. And I agree with you, Joe. We don't have to yell at each other. Part of my survival of being in activism since 1999, part of my strategy has been to realize that some people won't see things your way, and that's perfectly fine. I always, when I have my conversations with Tony, I say, you've got to allow people to simmer in their own stupidity at the best of times. That, that is perfectly fine.
I
It is
love you,
a
Leanne.
way of preserving yourself, because when you work in activism, almost always there's something to push back at. There's something there's always a cause to fight. And, breathing techniques is not for all of us. Sometimes, you can breathe all you want to and you can do all the yoga in the world, but it's really for me about figuring out what works for you as a person and, like, how do you move through the world? It's taken me a very long time to come to the realization that sometimes, folks are not going to see things your way. And it's okay to greet them at parties and when you see them at the market. And the rest of the time, it's okay to push them to the back of your mind and do what is necessary for you to survive as a person and as an activist, most importantly.
You know what you remind me, Leanne, because very funny and spot on. I think the role of humor, the role of laughter right now, the role of joy, and us not, while we're angry and we have a lot to be angry about justifiably and so many causes to fight, just maintaining our humanity also means maintaining our happiness, our joy, our connection with each other, and not letting them beat that out of us as well. And I think the more we can radiate happiness and joy and humor and dare I say fun, it's more attractive to bring people into our cause as opposed to always sort of being screaming in anger. And I recognize, as someone who screams in anger a lot, the role for that, but there's also the role for humor and joy. I wonder if anyone wants, and you're right, not everyone, breathing techniques are not for everyone. They're certainly not for me. I'm too impatient with breathing. But who wants to talk about sort of how we thread in this, how we don't lose joy, how we maintain our sharpness and our edge where we need it, and that we don't lose the inherent joy and beauty and amazingness of our
You know,
communities.
Jim, I'll just say this, that it is incredibly revolutionary and powerful when, despite our circumstances, that we are able to experience joy, even in moments of great adversity. I don't want to sound like Gandhi. I'm not one for philosophy, but there's just something incredibly powerful. And I learned that in the feminist movement about, walking on coals, but doing so with the greatest joy. It's called revolutionizing trans joy.
I
Thank
think
you.
we
Go
have
ahead, Mel.
so much to learn about self-care, and it's so important, particularly for providers, because we're often focused on taking care of others. But I think we all have to focus on our self-care right now. This is a constant assault. It's destabilizing, it's demoralizing, it creates anxiety, it creates depression. And we have to, first of all, protect ourselves from being overwhelmed. Turning off breaking news alerts. It dawned on me that I am not personally responsible for everything that happens in this administration. And, my wife and I have had this conversation, and she finally turned off the breaking news alerts on her phone. We'll find out about these things all in good time, but we don't need to be assaulted by it. I encourage my patients to go on a news diet if they're really being harmed by this constant 24/7 news cycle. And I think individually need to think about what renews us. I love the idea of joy. Doesn't have to be breathing, but I also like the idea of touching grass. Go outside, take a walk. I love dogs. I have dogs. They drive me crazy, but it changes the direction of my mind sometimes. Stay in touch with friends, not friends who are necessarily involved in our particular professional struggles, just friends, maybe somebody you went to high school with, maybe somebody that you haven't seen in a long time, maybe relatives that are non-toxic if you have any of those. And but I think reaching out to people and staying in touch with them and supporting each other professionally. Those of us who are in this movement, we all get depressed. And, I think giving to others can also be self-care, if you identify people who are affirming and who are really important to you and, to recognize that they need support too. So, I really think we just need to spend more time on that and need to also remind our friends, our clients, our patients, our colleagues that taking a moment to care for ourselves is really putting the oxygen mask on us first before we take care of other people.
Thank you for
will
that,
say
Melanie. And I see Joe is right in line.
a community takes care of itself, right? And so, and after the election stuff, I took my best friend who's trans, who's in the trans movement and like literally looks up legislation every day about trans healthcare and how they're being attacked and all that stuff. And we just went to the art museum, right? And we just walked around the art museum and we looked at art and we saw so many stories of people who have survived all of this stuff. And then I'm in the Gateway Men's Chorus, which is just silly. But we sing we sing Lady Gaga covers, right? And like seeing 70-year-old gay men sing Lady Gaga covers is honestly the joy of my life. And it's silly, but what was a reminder is just showing up and being there and being a beacon is enough. But I also want to emphasize that we need a paradigm shift of how we talk about LGBT health and all this stuff. Like, I've had this argument so many times at WashU, but like, joy is never centered, right? We talk about substance use, we talk about depression, mental health issues, all that stuff, and never do we mention joy. And so I think that actually taking, you know, that reminding people that my gender diverse folks in clinic are they are my ray of sunshine. I have so much fun. We cackle, we have a great time despite it all because we have to. We have to survive. So just a reminder that we need to shift that paradigm as well, not just like in community and all of that stuff, but even in the structures that be really centering queer joy as part of LGBT health and the center of LGBT health is what we really need to work on as well, especially if we're going to rebuild this, right?
Love that. Love that. Love that. Asa, do you want to jump in? We are in our final minute, so it'd be great, I think, for everyone to sort of share, for the speakers to share your take homes, like centering queer joy, for instance, and anything else you want to add. And of course, we still have time for others to chime in if you want to raise your hand in these last minutes. But I'm going to turn it back to Asa.
Yeah, I mean, I just love all of this, and I love everyone on this panel. I know so many people on this call. It's this is what keeps me going, right? So, despite everything, I know there are people I can call on, there are people I can phone, people I can be joyful with, right? So, we will get through this. I don't know a better way of saying it, we will get through, the care will survive, and we will continue to exist
And thrive.
and thrive.
Damn it. All right, I'm going to do last minute thoughts. Leanne, do you want to give us a last minute thought from gorgeous South Africa?
I don't know how gorgeous it is, but here we are. Here we are trying to make sense of it. For me, I think the entire point of human beings is, of humanity is really just trying to find meaning. And one of the ways I find meaning has been to, through my own struggle as a trans person in South Africa, to kind of like create those pathways. It is not like it has been in 1999. It is not. And we've seen waves of change and progress and setbacks. And, it's been a lot of, up and down journey. But it's also really important to recognize that we have come a long way. I personally, as a trans person, have, I wrote and I publish, and I see that as an offering, to policymakers, to impact positive change. Many years ago, I didn't work for, but I worked with the South African National AIDS Council. And there was a moment in which we were talking, and we're developing a strategy for, the new incoming grant from the Global Fund. And in just a few seconds, I got up and I said that, please don't call trans people for HIV tests unless you are offering it alongside some form of gender affirming care. And that opened the door, at the very least, to have hormonal care. We didn't necessarily get the surgeries that we wanted and so much needed, but it has been a step from where we were to where we are now. And that gives me joy. Like that, that keeps me going. That makes me want to get up every morning, because it's those kind of small ones that really keeps you in. And some community members have been saying, oh, you've moved a lot into academia. For me, it's never been, publishing articles has never been a gateway to academia in any case. It's really, for me, that labor of love for policymakers, for clinicians, to help us think of what we go through as a community. And even though for the last few years, when it comes to trans people, we've only been talking about HIV, there's a paper I wrote in which I explain and said, this is how I've used HIV advocacy for us to start a discourse on trans health. And that has been incredibly powerful, to when you get called to talk about one topic, but you're bringing all these other things. And that for me is really going to be the starting point of all these innovations that we not just want to drive, but what we need to drive as healthcare systems are starting to think of key populations without external funding. It's going to take a lot of patience. It's going to take a lot of love from all of us, and recognize the ability that even though we're not on the same page, there's always the potential for all of us to get on the same page. I'll stop there. Thank you very much.
Well, what a beautiful, really way to sum up this webinar. Everyone will get a last shot here, but that was absolutely perfect, Leanne. And Rebecca Dennison and I, and I'm sure others, want to see this paper you're talking about. So please share it with me, and I'll send it out in the resource list to everyone here. So Leanne, we want to read your brilliance. Share all your papers. Share your entire library. We need to get caught up on some of that, I'm sure. Melanie, Joe, or Asa, any final comments before we close out today?
I know we're short of time, but I just want to say thank you for including me in this, and thanks to everybody who is participating in this webinar. Thanks for your comments in the chat. It really has fed my soul. And this is so important that we have a lot of positive things going on. I think some of the takeaways that I've gotten are that we all believe in centering community. We need to do a better job of doing that. And centering community really is fundamental to the work that we do. We need to do a better job at self-care. and centering joy, queer joy. I love that. And, you know, I think we need to focus on what we actually want to work on, what advocacy we can do, recognizing we can't do everything. You know, in the US, can you call your senator or representative and just say fund SNAP? I don't know. Simple things, do the things you can do. Don't bear the burden of everything you can't do. We are stronger together than we are individually, and we take that with us every day. So thank you.
Thank you, Melanie. And it's that beautiful wrap up was one of the many reasons why we wanted you on this panel. So thank you for all your contributions before this panel, everything you've done before and everything you will be doing after. Joe or Asa, final comments?
Asa, do you want to go?
Yeah, I mean, really to echo everything else that's been said, you know, it's been an exhausting year. I'll say that, but you know, I think this, especially this talk, this webinar has just reminded me of, you know, the importance about, you know, staying connected to community, to colleagues, you know, to purpose, being intentional about rest, joy, you know, as everyone has said, centering queer joy and, you know, finding moments of hope, right? And seeing people continue to show up despite everything that's happened. Thank you all for being here.
Thank you, Asa. And Joe, I think you're getting the last word.
Terrifying. Always grateful to learn from everybody on these calls. And I think it's, if I can have a last word, is to continue to learn from other people, especially people who have been through these experiences before, who have been through worse, who have had different experiences. I consider myself lucky to be in some of the rooms that I'm allowed into and just get to, you know, I recognize that I'm one of the younger providers in the room oftentimes, but it is really, really lovely. And I love seeing younger folks, even younger than me, in the room and providing their perspective, but constantly learning, understanding, you know, I like the saying in my head, which is, you know, prepare for the worst, but hope for the best. And it's intentional. We know that this is probably going to get worse. We know that this is probably going to continue. They've laid out their plans. They know what they're doing. But having contingencies on contingencies on contingencies for us, and having those contingencies being based on community input, is the way that we move forward. So, you know, protect yourself, protect your sphere, and always have a little bit of time for queer joy, because that is the best form of resistance. But at the same time, the fight goes on.
And queer joy is for all, whether you identify as queer or not, because queer people are generous and we have so much joy to share. So queer joy for all. I'm going to end it there. Thank you all. I'm so grateful for our panel, for all of you, for this community. This has fed my soul too. I'm on a daily roller coaster of rage, and between rage and freaking out and lying in the fetal position. And right now I'm in a much better place. We'll see if I go fetal later. Thank you. We will be sending out the recording shortly with a list of all the resources that we've shared, and the stuff in the chat, because I think the chat is really juicy today, especially. I hope you'll join us on November 17th, where we're really continuing the same kind of discussion. It's very much a community-oriented discussion with another great set of panelists. I hope you'll be here. And until then, thank you. Turn off the news. Find time to rest, take care of yourself, and let's, you know, keep working on pushing forward and doing what we can. So thank you for that. Have a wonderful day, all. Take good care.
Thank you, everyone. Bye-bye.